Kuzizampo, I'm Sonam Pem. Welcome to our program on lead exposure and maternal health, protecting mothers and babies. Pregnancy is often described as one of the most beautiful journeys of life, filled with hope, joy, and anticipation of new beginnings. But what if something silent and invisible could threaten that joy even before a child is born? The National Blood Lead Survey 2024 has revealed a worrying truth. Nearly 6 in 10 pregnant and breastfeeding mothers in Bhutan have unsafe levels of lead in their blood, a toxic metal that can harm both mother and child for life. Today we discuss the risks, impacts and solutions with two distinguished guests. First, Mr. Karma Wangdi, Program Analyst at the Department of Public Health under the Health Ministry, and Dr. Tulsi Sharma, a pediatrician at the National Referral Hospital. Thank you both for joining us. Let's begin by first understanding the issue. Mr. Karma Wangdi, the survey results are deeply concerning. It says that nearly 59% of pregnant and breastfeeding women had unsafe blood lead levels. So from the ministry's perspective, how serious is this finding for Bhutan?
Thank you, first of all, giving me the opportunity. So as per the survey, I think we had 3 out of 5 pregnant women had a high blood lead level in the blood. So I think it is a very serious concern in our country, and moreover this is the first survey that we have carried out so far. And I think once that this lead is a very toxic to the human health and there is no safe level. So if pregnant mother is exposed with the lead exposure, then I think the child will be affected while delivering or even during the pregnancy. So that is why I think the survey has, I think, is alarming, and I think it's a very serious concern for our country.
Doctor, for many mothers, the word lead itself may sound very unfamiliar. So could you explain in simple terms what lead is and how it actually harms a mother and her unborn child?
Thank you very much once again. It's a great opportunity for us to inform our public on the harmful effects of lead. Basically, lead is a heavy metal and it's toxic to human health. That means it has bad effects on the human health, and it gets into human body through various routes, like through breathing, through ingestion with the food, and through skin, and also from mother to child. These are different routes of exposure of health, and usually heavy metals like lead are present in many of the components. Later in the discussion we can come to that. And this toxic heavy metal, when it gets into the body, especially in the pregnant women or women of reproductive age, it stays in mother blood and it gets stored in bones, and then it can be there for decades. And during the stress of pregnancy, the lead is released and the unborn baby is affected.
Yes, so like you said, it gets stored in bones and it's released during pregnancy. Yeah. Could you walk us through how this transfer actually happens and why unborn babies are especially vulnerable?
When we are exposed to an environment where there's a lot of lead in our environment, through the years the lead gets absorbed into the blood if there is exposure in the environment through various mechanisms or different routes like breathing or through the food and through skin or from mother to child. And as the times passes by, the accumulation of lead increases in the body and it gets stored in bones. And when mother is pregnant, in the process of pregnancy, a lot of hormonal changes occur, and it is an anabolic processes. So during this stress of pregnancy, the lead which is stored in the blood, bones is slowly released into the blood, and when the lead that is stored in the bone goes into the blood, and then basically the unborn child gets all nutrient supplies from the mother through the umbilical cord. And when there is lead in the blood of the mother, and then when the blood passes to the fetus, unborn fetus, the unborn fetus gets the lead from the mother. That's how the baby is affected. The level of blood lead level in the maternal blood depends, and the side effects or the consequences of that blood lead level is directly proportional to the effect on the baby. And for your information, any level of lead in maternal blood can affect unborn baby, and almost all the organ system in the developing fetus are affected. So depending on the level, there are different side effects which I'll discuss later.
Yes, we'll come to that. Mr. Karmal, the survey mentions cookware, spices, cosmetics, and even religious items are possible sources. So how widespread are these risks in our homes and the market?
Thank you. As per the survey, I think the finding of the lead source was, I think it is widely spread. The source of lead contamination was widely spread, like as you said, that it is in the kitchens where, then hardware, then even the religious pills, then even I think utensils was there. And as recently we had done the lead source tracing in the, I think, few sticks. There also, I think we are just now analyzing the data, and I think we wanted to compare whether that was a real source tracing or not at the moment. I think that we in our country it's very difficult to get the single source of lead contamination at the moment. It is very widespread, and I think in order to do the intervention also, we are now, I think we have to tackle many sources of I think lead contamination. So that is a huge challenge for us.
Talking about impact on mothers and children, doctor, what kind of health problems can lead exposure cause in babies and young children, both in short term and later in life?
Thank you once again. It's a very important question. And as I was talking earlier, like when the mother is exposed and the blood lead level gradually increases in the mother, the amount of blood lead that the baby gets from mother, as the level of lead level rises in maternal blood, almost equals to 70 to 100% of the maternal lead that goes to the baby. So if there is minimal exposure in the maternal and the baby also is minimally affected, then initially the growth of the baby inside the mother's womb will be affected. It will be restricted. That is called growth restriction, and then there will be a reduced fetal growth. And as the level of lead rises up, it increases to maybe around 10 micrograms per deciliter. Then mother might give rise to like premature delivery. Baby might be born prematurely, and sometimes even it can cause spontaneous abortions, miscarriage. And if the level rises, then it is fatal. It can baby will be severely affected, and then baby will not survive. And those are the immediate effects of pregnancy. But in the long term, if the baby is delivered, there will be complications of low birth weight and prematurities, and there are a lot of complications. But definitely baby will be affected in the cognitive performance later on, and baby will not be able to achieve academically. It will be impaired, and there will be a lot of behavioral problems, and so those are the long-term complications of lead exposure during antenatal period to the unborn child in the long run.
Yes. Mr. Karmal, globally UNICEF estimates nearly 800 million children to be affected by lead poisoning. So given Bhutan's small population, do we know the potential scale of the problem here?
As you said, I think globally it is a huge concern, and even compared to the global, I think even the Bhutan now, based on that survey, I think we have a 76% of our children. So I think Bhutan is not exceptional compared to other countries. So I think Bhutan is at 76% is very alarming, and I think now we must, I think this is just beginning for us, and we are now stepping towards the interventions in terms of because of this 76% is a very huge concern for our I think is concerned, and moreover I think pregnant mother is 3 out of 5 pregnant mother is at high blood level, and if you compare to children in the institutional like monasteries and everything, I think we have around 86% of the children below 13 years. So it's a huge concern, I think, Bhutan compared to globally.
Yes, the survey also found that many women had never heard of lead poisoning. Why do you think the awareness is so low, and what can the ministry do to change that?
Yeah, I think as you mentioned, it is very true in our country. Since this lead is a very new emerging for us in the Bhutan, because although the lead exposure was there in previously itself, but we had limitations in terms of resources or in terms of capacity, and I think we could not do intervention in the beginning, but now knowing the result of the 2024, now Ministry of Health is in collaborations with the donor agencies or some, I think we are now stepping towards for moving forward, so that in the long run we can tackle this lead exposure issues in our country.
Yes, Dr. Tulsila, you were mentioning about the short-term and long-term effects. From your clinical experience, are you beginning to see cases where children's developmental delays or learning problems may be linked to lead exposure?
That's a very interesting and difficult questions, and we do have significant number of children with developmental delays, behavioral problems, and cognitive impairment. But currently, I think it's too premature to say it is because of the late exposure. And many children are showing these signs and symptoms or these complications. Only I think as the time goes by, as we develop all the preventive measures and we conduct further research, then Bhutan will generate evidence and will be able to inform our public the correlation between the level of lead and the ultimate consequences. But for sure we know if there is maternal exposure, babies will be affected.
Yes, Mr. Karmala, you mentioned that National Lead Prevention Strategy is being drafted. Could you share what this strategy will focus on and how soon it will be rolled out?
I think now Ministry of Health, with the support from donor agencies, I think now so far we do not have the strategy to do the intervention in terms of lead poisoning prevention. So now we are developing the national lead poisoning prevention strategy in our country with consultations from different stakeholders, and I think it might take almost, I think by the end of this year, I think we will be able to have final versions of the national strategy, and we are focusing at the moment, as I said, that lead is a new emerging issues in our country, and to tackle that we don't have anything at the moment. So just to say, but we are focusing mostly in terms of now in that lead strategy. At the moment we are focusing in the 4 areas, strategic priority areas, like number 1 is on the institutional arrangement, like policies, regulatory frameworks, and other thing is in terms of capacity building of our human resources, then public awareness in terms of lead poisoning prevention, and also we wanted to do the surveillance and research at the last surveillance and research in terms of lead exposure. So we are focusing at the moment. We are focusing in the areas of 4 priority action in the national lead strategy. So by the end of this year, we are hoping that we will be having panel, so that everybody we do the intervention on the lead poisoning prevention.
Are there plans to regulate imports or strengthen standards for items like cookware, paints and cosmetics that may contain lead?
So at the moment, yes, but I think in terms of the lead, I think it is not only the health Ministry of Health alone, but I think to do the intervention we need intersector, multi-sector. So I think at the moment Ministry of Health is initiating the process, but at the long run, I think it's we have a different mandate. No, some have the I think regulatory framework, but we will process, initiate, and we will request whoever the late agencies to focus responsible in terms of regulatory, whether we wanted to import or not. But as a initial stage, I think Ministry of Health is initiating the regulatory framework so that other stakeholders will take their own responsibility in terms of regulatory frameworks develop, whether regulate at the source of entry or so. That will depend on the responsibility of individual agencies and ministries. But we are initiating the regulatory framework at the moment.
Dr. While eliminating lead may take time, what can mothers do right now to reduce risks, for example, through nutrition or daily habits?
There's a lot that we can do, but as a growing young adolescents from that time, till the time we get married, it is very important to reduce our exposure to lead, though there's a lot of lead in the environment. We know like the sources of lead, from cookwares to the workshop areas to paints to jillab and our cosmetics and so many things. But at the minimum, for general public and in particular to the women of reproductive age, what they can do is like wash their hands regularly, so that if their hands is contaminated with lead, they can get rid of it at the source. And if you are working in like workshop and all those places, please put on the personal protective gears, and then when you come home, remove the gears at your own workplace, and as far as possible try to avoid handling the equipments that are laden with lead, for example the car batteries and the waste from the vehicle, mainly car batteries. And if you are working in the landfills, be careful about the electronic waste that is being disposed. Always wear the protective gears. That's one thing. And other important thing is like if you are nourished well, you can protect yourself. So lead and iron are absorbed through similar mechanisms. So if you are anemic, if they are deficient in iron, I would suggest to take nutrients that are rich in iron, like green vegetables, red meat, and boost up your iron stores. And in the meantime, the addition of calcium and vitamin D also will help reduce the absorption of lead from the intestine. So basically it is very important to wash your hands, reduce exposure to the environment which is contaminated with lead, and have a very balanced nutritious diet rich in iron, calcium and vitamin D. Those measures will help the mother to reduce the absorption of lead and also complications to the unborn child.
Now coming to the end of the program, Doctor, if you could give one piece of advice directly to the expecting mothers watching us today, what would it be?
Please, as you know, like we have been advocating through various media, like the risks of lead exposure to the mother and to the general populations. And if you are in a risky environment, or if you think like you are exposed to lead, please contact us, and they can come to us. But currently we do not have any laboratory support to check blood lead level in the mothers. But if the mothers comply by whatever advice that we have given, regular hand washing, reduce exposure, having healthy diet, and even after using the religious items and all, better to wash their hands. If you do all those things, it will go a long way in reducing exposure to lead. Thank you.
And Mr. Karmal, what message would you like to convey to the public as Bhutan takes its first step in addressing this silent health threat?
I think it has already been highlighted by Dr. Tulsi, but even then, just to sum up, I think as we all know that lead is a heavy toxic poisoning, heavy metals, and even the low level of lead can affect our human life. So, and there is no reversible effect if you are exposed to the, and moreover there is no treatment at the moment. So the solution is the prevention. So I think we need to take care mostly on the preventive aspects, and I think once we have this on regulatories and everything, I think every community, be it at the ministry, agencies, CSOs, others, needs to come up to support, and I think so that we can make our future generation lead free from our country.
Yes, thank you, Mr. Karmawangde and Dr. Tulsi, for sharing your insights. This discussion reminds us that protecting our children begins long before birth and sometimes from dangers we cannot see. Lead poisoning may be invisible, but its consequences are very real. With awareness, better nutrition, and strong public health measures, we can protect the future of our mothers and children. Thank you for watching.